Welcome to this channel. If this is your first time, my name is Nurse Merit and I'm a nephrology nurse. So we're going to be talking about things that women do. Basically, it should be more than 8 that women do that causes recurrent infections for them, that causes recurrent cyst infections for them, and how to treat it. In fact, most ladies are treating yeast infection and candidiasis the wrong way. Okay, so please listen attentively. If you're coming from Facebook, from TikTok, please, this is a total different video excuse me, from where you're coming from. Now, number one, you may have known is if you are not washing your vulva. Like I've said, locate that video on how to wash your vagina and your vulva. These are two different things. If you're not washing your vulva, you are born to have infections because the urine contains bacteria. So as you urinate, it's spreading around your skin. Okay, as it's spreading around your skin, you just use water to wash that fleshy part. It's not going to go out. The microorganisms will remain there. The vagina is the one that is self-cleansing. Your vulva, it is not self-cleansing. Skin is there, so you have to wash it with mild soap. You can use Dove, you can use Femme Fresh, you can use what are they? They are many. I've forgotten. Okay. You can use any soap that is mild, but don't put it inside. Don't wash inside. Wash the outer part and with enough water. Number 2, you are semen. Okay, like I said before, semen causes recurrent infections for you. Okay, semen or yeah, not that it causes recurrent infection. It throws off your vagina pH because your vagina is acidic, semen is alkaline. So when they come together, it throws it off. That's why when women notice, they have sex, it keeps throwing off because of that semen. Okay, so all you need to do is you have to be treating recurrent yeast infection by using boric acid. Okay, there's a brand I represent, actually, Temptiment Essentials. They are on Instagram, so you can just chat them up to give you boric acid. Their own boric acid is quite mild. Okay, number 2, it will help to restore your pH balance, and they have some certain things like probiotics. Apart from them, you can go anything that is probiotics, but these people's own is also a good probiotics. Then eat fruits that are very good for your vagina. For instance, eat yogurt, fruit and vegetables. More of vegetables. Take vitamin C, build your immune system. These things will help nourish your vagina. Okay, yogurts that are Greek yogurt that have the good culture in it will help with your vagina. Okay, so having known about this, the number 3 thing that you do is douching, which is putting your hand in your vagina. Like I mentioned, anything that will make you put your hand in your vagina, stop it. When you're washing your vagina, you wash the outer part of your vagina, that's the vulva. Don't put your hand inside there. That thing you're trying to bring out is good. It is because you've been putting your hand there, that thing is seriously, forming infection, is seriously forming infection. That is the problem. So don't put your hand inside there. It's seriously making it coarse. It's supposed to be, normal, flat, but because it's now causing yeast, it's now becoming like chalk because you're trying to bring it out. You don't enter there. Okay, so after treating this infection that you're going to treat now with the boric acid from those people, all you need to do is don't put your hand there. If you're having infection, treat it, but don't put your hand there. If you're washing, wash the outside, please. Okay, don't put anything at all there, even water, even your hand. So this brings us to the next one, which is fingering. For men that likes fingering, sometimes they come back from work, they just pushing the hand inside there, they don't wash their hands, so this will cause recurrent infection for this woman. So if before you finger, make sure you trim your nails. Make sure the nails is well trimmed, and it's not all of the time. Okay, if she likes it, but just trim the finger. Make sure it's a very good hand that you're putting in there. Okay, that there's no cream, you didn't rub cream in your hand, you didn't just neat hand, and afterwards she washes off. With the food you're eating, your immune system will be built and you will not always have recurrent infection. Okay, now the next thing that women do that causes recurrent infections for them is using nylon panties. Yeah, nylon panties or G-string. I wear G-string, but look for the ones that are cotton. Okay, so G-string tongues are always made with nylon, so this will cause reoccurrence. Because I don't like that line, me myself, I don't like it, so most women too don't like it. So if you're going for the tongues, look for the one that is cotton. Okay, so apart from that, cotton panties is very beautiful. Okay, so, and sometimes try to sleep naked, especially at night. Try to sleep naked. This is very important. Okay, try to sleep naked. It is going to help you a lot. Okay, now the next thing that causes this is, please, I know, but giving head sometimes causes recurrent yeast infection. This is why, because the saliva has a lot of enzymes that works on the food. Okay, so these enzymes, when they get inside the vagina, they disrupt the environment. It's enzymes. Okay, so these things are supposed to work on food. They start working on those good bacteria that you have, and they kill it, and then you start having infection. Okay, so the next thing that causes, so what you need to do is, please, if you're the one that like the head, your partner has to do it out. I don't know how you guys, but just know that this can cause recurrent infections for you. Just notice it. Calm down and notice it. If you leave all these things, you find out that you're more better. Okay, now the next thing that can cause recurrent infection is women that are trying to use what is it called, use antibiotics to treat infection. Antibiotics does not treat candidiasis. Okay, antibiotics treats does not treat, is bacteria, is for bacteria. Meanwhile, yeast or candidiasis is a fungal infection. So it is used, what is used to treat this infection is fungal infection, antifungal drugs. Okay, so try to use antifungal drugs to treat it. Don't use antibiotics. Antibiotics will cause more yeast infection for you. It's going to kill those good bacteria that is there and cause more infection. This is why people that are taking antibiotics, they say the doctor prescribed, I don't know, it's not possible. They are having, even when you're just treating yourself normally. I had it 2 days ago. I was treating myself normally of typhoid. Typhoid and some, I was treating. I found out that I started discharging. Sign of yeast infection. Said I've not had yeast infection for like, it's getting to 7 months now, 8 months. I've not had yeast infection, but it started because it has killed. It's too powerful, so it's killed it. All I had to do was to put in boric acid there. And this is also why I'm also telling you about those people. You can chat them also on Instagram, on Instagram too, and ask them to give you boric acid, or you want to treat your reoccurring or yeast infection too. Remember, I'm putting their number here. I'm not supposed to, but I'm putting their number here. What else? You can just chat them on WhatsApp, or if you're on Instagram, you can just chat them up. So what else causes recurrent yeast infection for my beautiful ladies? Yeah, is low immunity. Okay, try to build your immune system, right, by taking antibiotics, by taking vitamin C, 1000 milligram per day, but not every day, but like 4 or 5 times in a week. Drink a lot of water if you're taking vitamin C. Locate that video on supplement that every woman must take here on my YouTube channel here. So these are basically then the final thing is, if you're treating yourself, when you're treating yeast infection or whatever, please don't have sexual intercourse until you're done. Don't have sexual intercourse when you're done. Then your partner is treated, because your partner is treated. I know yeast cannot be transferred, but your partner, men have yeast infection. Okay, so your partner is also treated before you resume, and you're sure you're done. Probably you went to the lab and they said there is overgrowth of yeast and they gave you drugs, and after that you still go back and then they said the yeast has gone. This is when you can now continue sexual intercourse. Okay, when you're sure the yeast has gone, your partner is okay, both of you have treated yourself, then you can go ahead and continue your sexual activity. The next thing that causes yeast infection is some certain lubricants. Yes, some certain lubricants, oil-based lubricants, can disrupt your vaginal pH also. So if you're going to tell them to give you the water-based lubricants. Okay, then some oil too, trying to use coconut oil, trying to use some your baby oil, this thing. So this thing is going to, these oils are going to disrupt your vagina too. Okay, so having known about this, the next thing that can also make you have reoccurrences, because you know, we women, our body somehow is not like the men's. Okay, if your man is putting in their whatever as you're going to take your bath, when coming to your man, let your man also do the same. Don't be scared. Tell them to do the same, to wash. You're washing your panties, let them wash their panties also. Did I mention? I don't know. Okay, I don't think I mentioned it. Please try to sleep naked in the night when you're done with all your this thing. Just sleep naked. Lock your door. You can wear something very loose, but allow that place to breathe. Allow it to breathe so that air will enter. Okay, so that after all the heat, the stress of the day, the place, there will be air. The next thing, I presume should be the final thing, is use water to wash after urinating. Okay, stop using tissue paper. Okay, except when maybe once in a while there's nothing, you can just use when you come home, you wash. The best thing to use after washing, after urinating, is water, so that it can clean off the whole stuff. Then but if you're going out, you can just put wipes, all right, in your small container, in case. Wipes is the second thing. Okay, wipes that don't have alcohol, feminine wipes. Okay, this is better. So I think that will be it. On our next video, I think we've already done video on how to calculate your ovulation, signs of ovulation, how to treat pelvic inflammatory disease. So on our next video will be on how to boost your ovulation. I also have videos on how to bring back your ovulation already. Look at those videos here on the women's playlist. So we'll talk about how to boost your ovulation on our next video. Please like this video. The number of likes will make me see if I'll talk about women's stuff, because if the kidney, the diabetes things are getting more like than the women stuff, so I have it in mind, it's meaning that people in this channel are mostly not interested in the women stuff. So I will continue on the kidney stuff. So if you like this video more, it will give me an idea that you are enjoying the women stuff, and I'll bring it on. Okay, bye.